Hi, I'm Dr. Kylie, a wife, mother, entrepreneur, chiropractor, and I love numbers. I love numbers so much that when a new patient comes in to me, I request their medical records because you can find so much from labs that they've already taken, even if they've been told that their labs are normal, yet they feel like crap. You can learn a ton from those. What I'm about to talk with you today is how to set up a treatment plan using labs they've already taken. Now, this is for you if you have difficulty setting up treatment plans, if you have a hard time getting patients to follow through with those treatment plans, if you really just want your patients to have better success faster, if you want to improve your business, holy cow, you can learn treatment, if you can set up a treatment plan off of labs they've already donated their blood for, they've already paid $3,000 for or whatever, and they've already sat through a whole host of doctor's visits and just been told, oh, your labs look good, you should be fine. And then they go home and they tell their husband that the doctor says nothing's wrong with them, and then their husband is starting to question the same thing. So, if you're looking for improved business, improved treatment plan access, improved patient compliance, improved patient results, stick around because I'm about to dive into one patient. We're going to go through her labs and I'm going to teach you how to use a metabolic panel, a CBC with differential, a lipid panel, and design her treatment plan, a personalized treatment plan, based off of her labs. So 1, she can have confidence in her treatment plan. 2, she now trusts more in me and soon to be you. 3, her compliance goes crazy high. And 4, she goes out and tells all of her friends that this doctor, this chiropractor, this functional nutritionist, this coach was able to sit down with her, go through her labs, tell her that yes, something's wrong. Yes, you're not crazy. Yes, there's a reason why you can't get pregnant. Yes, there's a reason why you can't physically get out of bed. It's going to confirm to her and to her husband and to the rest of the family that there is something wrong. And it's not just going to be another jump through the hoop. Now, use this line. When I talk to patients, when I'm looking at getting them in or working with them in my practice, I want to be sure of one thing, and I tell them this. I will work with you if, here's what you say, I feel confident I can be the last doctor that you tell your current story to. They love it. They will drool after that. And personally, that's my goal, is I want to be the last doctor that they tell their current story to. I don't want to just be another doctor along the path. If you can do that for your patients, business is going to go up and treatment plans are going to go better, compliance rates, all that fun stuff. So here we go. How to build a treatment plan using labs they've already taken. One quick thing before we dive in. I get these labs by requesting their medical records, and you can easily do the same thing. Google search medical record request form, you'll find one. Manipulate it as your own, then all you have to do is have the patient sign it. You fax it off to the clinic, you fax it off to the hospital. I mean, I've received faxes where I've stopped the fax at 200 pages in because I don't need any more information than that. But you can easily get access to this stuff if you have a doctor's license, of course. If not, ask the patients to get it for you. It's really easy for them as well. Okay, so here's our patient today. We have a 35-year-old female. Her biggest concern is infertility. Now let me walk you through, let's just go 5 years back in her timeline. She's been struggling, she got married 7 years ago. She's been struggling with infertility. They did birth control for a year, got off birth control, could never get pregnant, couldn't even ever have regular cycles. Multiple fertility clinics later, multiple fertility doctors later, She shows up to one of my classes on hormones and realizes that there can be answers in other forms outside of fertility centers. But her biggest concern is infertility. Along her journey, she has had endometrial cancer. What they found was when they were trying to do a fertility treatment, that would instigate this to come up. So when she walked through my door, she had had multiple surgeries to remove the cancerous portions of her uterine lining. They had also put her on medication to stop her uterus from growing, aka stop her cycle. Now, you can't get pregnant if you don't have a cycle. Medication was stopping this from happening, and she really wanted off, but she had no idea how, and she was absolutely terrified that if she got off her medication, this would happen again. Then we get into her inability to lose weight. Now picture her, I'm 5'6", she's 5'8", 5'9", well over 100 pounds overweight. She's tried every diet under the sun. In fact, multiple fertility doctors looked her in the eye and said, "You can't get pregnant because of your weight." As a mom, as a pregnant mom, that would crush me, and it crushed her. So she literally tried every diet under the sun to just lose weight because all of the doctors that she'd been to told her that it was her fault. And her husband, now he's a piece of work, so we won't even get into that story. But this girl was alone. She was on her own trying to get pregnant. She had a fantastic support family in her own family, but there was her family, her, and her husband. So just a crazy dynamic there. Well, as far as symptoms go, she had major headaches. She felt like generalized skin itchiness. I remember she would sit down and like she's talking to you and just itching all over the place. And that's just regular day-to-day life for her. Crazy amounts of foot pain. And I always ask about gut. You should too. And I say, do you tend to be more diarrhea or tend to be more constipation or neither or both? And in her case, it was constipation. So this tells you a lot right there and about her gut, specifically in terms of SIBO. So there's what you're dealing with. This 35-year-old female wanting desperately to get pregnant so that she doesn't feel like it's her fault that her and her husband can't have kids. Now, pull her medical records. Here's what we find. If you don't know how to read a CBC, definitely go back to that webinar that I taught you how to read a CBC. It's the easiest thing in the world, and it is life-changing for the patient. CBCs, when I get a good CBC in the office, my assistant will, when she goes through all the medical records and punches them into our file, into our little chart that we have, she hands it to me and she's like, "Merry Christmas," because she knows it's like Christmas morning for me. I get so excited when I can sit down with a patient and I can say, "Look, this is why you can't get pregnant. This is why your endometrium is overgrowing and cancerous. This is why you can't lose weight. This is why you're tired. This is why you have headaches. This is why you have generalized foot pain," all through numbers. It's not just me creating things up. They can see it. That's where the trust factor comes in, and that's where compliance skyrockets. So I don't have time to get into the whys or the what they are. Be sure you turn into the previous 2 webinars to learn how to read these. We're going to zoom through this, and I'll outline the patterns and remind you what you learned in the previous webinars. If you haven't joined in on those, go join in on them before you get to this stuff. This will be a great refresher and a great reminder and a great way to just say, okay, now I know how to read them, let's apply it. Okay, when it comes to her CBC, definitely get a CBC with differential. If it's without a differential, you're just wasting your time and you're wasting that blood draw. You have to have a CBC with differential. But the first part of the CBC is going to tell us about anemia. You're never going to see it, at least I've never seen it, a clear, distinct pattern on iron deficiency anemia or B vitamin anemia. If it's low, if these numbers together as a whole are low, you're looking at iron. If they're high, you're looking at B vitamins. You're going to have a jumblation of them, but go with like the most popular. So in this case, I really like this one because it's basically an overview of all this stuff. So the red blood cell count is high according to the optimal ranges. Remember, these are not normal ranges. These are according to optimal or functional ranges. So we're looking more at B vitamins. And when I think about B vitamins, there are so many foods infused with B vitamins nowadays. It's really not, usually not a B vitamin deficiency. Usually it's methylation. And that's where Morse comes into play. So if I see any B vitamin issues, I always include Morse. Morse is great for hormones in general. So there you go. There's from her front page of her CBC. Now, this is why I say differential is crucial. When I was in school, the differential meant nothing to me. Now that I have functional medicine training, it means everything. And I get really, really peeved if I get medical records and the doctors did not take the with differential aspect. And you'll see that. White blood cell count. If you remember, the range is from 5 to 8. So 8.05, that's right there, it's pretty good. If it was off, you're looking at low-grade infections, viral or bacterial. You can't tell which is which based off the white blood cell count. So then you jump down to neutrophils. Neutrophils, if you recall, fight bacteria. Lymphocytes fight viruses. You want neutrophils to float around 60, so that looks pretty good. You want lymphocytes to float around 30, beautiful. You want that 2-to-1 ratio. What that means is that autoimmune flare is non-existent. So say you have a patient that walks in with thyroid problems, you're suspecting Hashimoto's, you take her, you request her medical records, say she has got 45 and a 42. That would be a 1-to-1 ratio. That would indicate she has got an active autoimmune flare. Now, I've seen medical records from Parkinson's, from multiple sclerosis, from those crazy type autoimmune diseases, and I see a 2-to-1 ratio on them because it's not in that flare stage. So it doesn't rule out autoimmune disease, it just says, hey, you're not in an active flare. If you see a 1-to-1 ratio, they are. Now say lymphocytes are beautiful, they're right there at 31.8, but neutrophils are up like 73. Now I'm thinking bacterial issue. But when it comes to our patient, 35-year-old female with fertility issues, this looks good. Low grade infections, non-existent. However, we got these guys right there, monocytes. If you recall, monocytes, if you see them 10 plus, you're looking at Epstein-Barr virus. She's just approaching that, just slightly out of range. So maybe possibly we have a low-grade virus hanging out. You're going to find this guy a lot in your chronic fatigue patients. Eosinophils, here's the big one. This is another reason why you need to have a CBC with a differential. That guy, 1, it's going to indicate food allergies. 2, it's going to indicate parasites. So we have food allergies down here as well as parasites. Now, when I started treatment with her, I will tell you we started off destroying gut first. So what I used was all of the VRMs, 1 through 4, plus the WO oil rubbed on the bottoms of her feet, plus bind to clean up the mess. So we've got parasite destruction, we've got WO, and I tell people this is going to help your body handle what's going on inside. We've got bind to clean up the mess and get it out. All from the eosinophils. Now this too can be food allergies. I'll tell you her diet was terrible. Good in American ways, bad in functional nutrition ways. She was married to a dairy farmer. Now, if I were to picture you her husband, think of the Geico caveman. It's literally what he looked like. When he walked into my door, I was shocked. It kind of blew my mind that here's this well put together woman and this grungy kid, really. So he was a piece of work. But I asked her in our very first initial consultation, I said, can you make some dietary changes? When you get that first yes, then you can go into what they are. So I said, I know you work on a dairy, you live on a dairy farm. Would it be okay if you cut out dairy for a short period of time? She said yes, she could do that. And I told her, your husband doesn't need to get involved. He doesn't need to do it. I just want you to do it for 21 days. She agreed. So make things simplified. Be sure you get their approval when you talk about food changes. Basophils look good. Okay? So off of her CBC, we have ruled out anemia. We have ruled out low-grade infections, minus that possible virus, but we didn't play much into it. If you are worried about a virus, throw Vivi into the mix. VI. This one, I can't keep on my shelves because of this. I find Epstein-Barr virus and low-grade Epstein-Barr virus a lot. What you'll find is with mono or EBV, they'll say, oh, there's a possibility of you having a low-grade viral infection. Have you ever had mono before? Oh yeah, I had mono when I was 22. So they do have a history of an active flare of it. Once that virus is there, it's there. It's just a matter of, is it dormant or is it active, and to what grade is it active? So Vivi is in about every person's toolkit if they have a history of mono. Okay, we kind of went into this as I was going through that, but from our CBC, like I said, we rolled out anemia, we have food allergies and parasites. Our first step of treatment was to destroy the gut. Now, from her metabolic panel, here's the beautiful thing about requesting medical records, is that somebody else has already had eyes on them. So you're like the second opinion person, where when what they've been told didn't sit well with them, hasn't worked. But what you're going to see as we go through her metabolic panel, which is why I bring this up, is that she has some really ugly numbers that if you're not really good at dissecting labs, you could get quite terrified of these numbers. Which is why it's so nice that, hey, her MD and her fertility doc and her naturopath or her NP already had eyes on this stuff. Now it's just me looking for a dysfunction. I don't have to search for disease or be cautious about disease. So albumin, BUN, creatinine. If they're high, you're looking at kidney dysfunction. Now, key on to that word, kidney dysfunction, not kidney disease. Don't tell your patients they have kidney disease. BUN, if you can recall, low BUN indicates a need for HCl and a fixed leaky gut. Now we have other indicators for gut stuff. Creatinine, kidneys. When it comes to treatment, you're going to want For HCl, hydrochloric acid, I use DS or DB12. DB12. For leaky gut, I use L-gut. I combine it with Vista 1 and Vista 2. For kidney, you can use K for kidney or KS. Those are the two big ones. I tend to go more with KS because it's more for the sensitive type person. Sodium, potassium, if they're high or low, doesn't matter. Adrenals. Now, if you do anything with hormones, adrenals play a huge impact on the hormone system, the endocrine system. So really focus on the adrenals. So now as we're putting her treatment plan together, we know we don't have to worry about anemia, so we can skip that first step. We go straight into gut, destroy her gut. Then on the healing the leaky gut side, so first we have destroy, and then we heal, specifically the leaky gut, and then we replenish. We replenish with all of the probiotics, prebiotics, enzymes, hydrochloric acid, all that fun stuff. That's as far as gut goes. When I destroyed, like I said, we talked about the VRMs and the parasites because of the eosinophils. If you are worried about SIBO, we could also throw SIBO into the mix. What I find with the VRMs is that you can tackle SIBO along with it really well. Sometimes you need to use some extra stuff for, say for SIBO, we're looking at Bactrix. So I believe that's number 3, Bactrix. Number 4 is Fung DX. Use those in combination with your destruction protocol. When it comes to replenish for the gut, I use things like MBC, ABC, and I rotate through probiotics. We've got the DS and the DB12 for hydrochloric acid. You're looking at NZ for enzymes, all that fun stuff. Throw it into your 3-step gut process. Takes around 6 months. Voila, you have a 6-month treatment plan that the patient is very compliant with. After gut, you can jump into blood sugar and adrenals, which is usually my next step. So we know we have adrenals, and I'll show you a date later on down the road. We got blood sugar issues as well, which you would anticipate blood sugar issues with hormone issues and inability to lose weight. So we're looking at calcium. Calcium looks good. Chloride. Here's where you're getting into some ugly numbers. AST, ALT, remember, you're wanting that to be 10 to 26. We're looking at 91 and 121. Right here we have liver. I'm gonna make sure you know liver is a problem. Total protein and globulin. In this case, we don't have globulin, but total protein would be another indicator of leaky gut and hydrochloric acid. So we have multiple new indicators of gut problems. Chloride, we're looking at chloride as kidney. So we have another marker for kidney. Now when I talk about liver and kidney, I explain to patients that these are organs that are prime organs for detox. So I don't necessarily treat kidneys specifically or liver specifically. We treat the whole elimination system. And one way you can easily do that is PrEP Body Brain. And I will tell you her results from PrEP Body Brain. She did the first round of it, and then she was like, oh, can I do that again? Because her foot pain went away, her skin itching went away, her headaches were very, very minimal. But this was 3rd step into treatment. The first step was gut. The second step was blood sugar, adrenals. The 3rd step was detox. So in follow-up lab tests, I will also tell you, we took lab tests recently on her. These were completely normal after what we did. And her treatment plan was 12 months, very compliant through it all, didn't even hesitate when it came to the money issue. But that's because we went through her labs and I presented it to her in a way that explained, one, she's not crazy. Two, the infertility isn't her fault. And three, because she lives in 21st century America, this is a result. So labs look really good nowadays, but when I got them, they weren't pretty. Carbon dioxide, CO2 low, so she has that acidic pH in her body. We changed it up with the diet. That worked really well. She does I do a 21-day anti-inflammatory diet with people, and I say 21 days because if you were to tell me to cut out gluten for the rest of my life, I'd laugh in your face because Texas Roadhouse rolls are too good. So I'll tell them, you only have to do this for 21 days. They do it for 21 days, and it's like, oh my gosh, I felt so much better. I'm just going to keep doing it. Now your job's easy. Alk-Phos is the liver, I believe. Yeah. It's not bone growth in her. She is done growing. It is liver for her. So again, we have indicators all over the place that her liver is under high stress. And when it comes to heavy periods, painful periods, endometriosis, attack the liver. And then oftentimes you'll find something inside the gut like candida tied into it. But when that estrogen gets up, attack it from the liver standpoint because the liver is so backed up that it can't get to estrogen. And so estrogen just recycles into the body and that just keeps going higher and higher and higher. So any type of endometriosis or heavy painful periods, attack the liver. Okay, from her metabolic panel, we now know we've got kidney issues, we've got liver issues, which ultimately lead to detox issues. We need some adrenal work. What else did we cover there? More leaky gut, hydrochloric acid type stuff. All off of labs she already had. Beautiful. Treatment, like I've walked you through previously, we did gut, then we did blood sugar, adrenals. So for adrenals, I use GA. You can even use GB as well. Get that pituitary involved. Add in some Sinulin for sure when it comes to blood sugar and any hormone stuff. Get Sinulin in there. And I believe I also added in vitamin D. She lives in northern Utah. It's winter time. Everybody needs vitamin D. And when it comes to hormones, vitamin D is a great baseline as well. Now finally, her last pattern that I want to talk to you about, because you're going to see this marker a lot. Uric acid is high. If you start requesting medical records, you're going to see it a lot. And people are going to say that their uric acid is high. They don't know what to do about it. They don't have gout. They don't have RA. In that instance, and you see the rest of this, this is the perfect pattern for insulin resistance. You're also going to see this a lot. Triglycerides, total cholesterol, LDL, HDL, it all looks ugly. And their doctor's going to want to say, well, we got to get you on a statin, like Lipitor. They don't need a statin. They need help with insulin resistance. So if you see glucose is high, triglycerides are high, LDLs, the bad guys, are high, total cholesterol is high, uric acid is high, HDLs, the good guys, are low, fix insulin resistance. And the way you do it, Sinulin, vitamin D, CVO, Shake. I've been known to throw in GA and L-gut into the mix as well, because you get the full metabolic pathway. The adrenals play a role in the blood sugar. The leaky gut plays a role with inflammation, which then goes to the adrenals, which goes to the blood sugar. It's all just one hot mess. So depending on, say, their budget, depending on what you like to do with supplements, I like to keep mine very tight. My budget for patients is usually between $100 and $150 per month. So it's a very tight budget, but that's what I tell them to plan on. Sometimes we go over, but not very often. If I can get them on all of these at the same time, do it, because that's the full pathway for insulin resistance. If you just want a key 4, Sinuin, CVO for the healthy fats, vitamin D, and the Catabo shake to help that blood sugar. There you have it. You can now put together in my case, 12-month treatment plan that she complied to the entire time. I charged $549 per month, plus supplements on top of that, for 2 visits a month. Complied the entire way, loved it, dramatically increased her health. She has yet to become pregnant, but that's a whole nother story. I will tell you, with her her MSQ, her medical symptom questionnaire, she went from 178 down to 62 in less than 6 months. And I like to take the MSQ every 3 months. This, when we redid that, she was shocked. Because you have those slow improvements and they don't quite feel it, but then when you see that number to that number, she's like, oh my gosh, I do feel so much better. In fact, I haven't had foot pain in 2 weeks. I just haven't noticed. That's what you see when you dissect her labs, use the labs to create the treatment plan. Because now you have treatment plans that work. Now, once again, your compliance goes up, your business goes up, you're the hero, not the MD. You're the person that tells them that they're not crazy and they love you for it. Thanks, Systemic, for having me. Once again, I'm Dr. Kylie. Order those medical records, guys, ladies and gentlemen. You'll drastically change your practice. Promise. See ya.